Hello, it is now Jennifer speaking, and I'm going to continue with the second half of our presentation on the health promotion plan of our diabetic patient. So let's begin with a physical assessment, the head-to-toe examination with pertinent positives for our diabetic patient. The patient is experiencing blurred vision, which could be an early sign of diabetic retinopathy due to poorly controlled blood sugars. The patient is also positive for neuropathy. Diabetic neuropathy is nerve damage that can result from diabetes. In addition, the patient is experiencing increased thirst and urination, which are symptoms associated with hyperglycemia. Some areas to focus on when assessing the diabetic patient are blood pressure and weight control. Maintaining tight blood pressure control can prevent the diabetic patient from having a stroke, heart attack, visual problems, and kidney disease. Being overweight can increase the risk for complications. Losing weight will improve blood glucose, cholesterol, and blood pressure. Eye examinations are important to assess for any visual changes that can be caused by diabetes. Foot examinations are also important since diabetics often have neuropathy and may not feel a foot ulceration that could turn into a complication since they already have poor circulation for wound healing. Cardiovascular disease is important to assess in the diabetic since they are at higher risk for developing cardiovascular disease. Diabetes increases the risk for AFib because it causes alterations to the autonomic nervous system, which can also increase the risk for stroke. Since diabetic patients are at higher risk for developing atherosclerosis, it is important to assess for peripheral artery disease. The screening tests that are pertinent to a diabetic patient are hemoglobin A1C, fasting plasma glucose, random plasma glucose, oral glucose tolerance test, urine analysis, blood pressure monitoring, renal function test, and a lipid profile. The first two tests are most commonly used to diagnose diabetes. It's the hemoglobin A1C, which is a blood test that provides your average level of blood glucose over the past 3 months, and also the fasting plasma glucose, which is the best test to perform when a patient has fasted for 8 hours. The random plasma glucose is performed to test for diabetes when symptoms are present and the healthcare professionals do not want to wait until the patient has fasted. The oral glucose tolerance test is performed by drawing blood prior to the test, drinking a liquid containing glucose, repeating the blood test 1 hour after drinking the glucose, and then again at 2 hours. This test is more expensive to diagnose diabetes than a fasting plasma glucose. The urine analysis may show abnormal levels of acetone or glucose. Blood pressure monitoring. Maintaining a healthy blood pressure is important to prevent complications related to diabetes. The blood pressure goal for diabetics is less than 140/80. Renal function test. Diabetes is a major risk for kidney disease. So with diabetes, the small blood vessels in the body are injured. And when these blood vessels in the kidneys are injured, the kidneys cannot properly clean the blood. And a lipid profile. It's a direct measure of the 3 blood components: cholesterol, triglycerides, and high-density lipoproteins. This blood test requires the patient to fast, and people who have type 2 diabetes tend to have high levels of triglyceride and low HDL levels. And while people with type 2 diabetes tend to have similar LDL levels as people who don't have diabetes, their LDL particles seem to be smaller and more prone to causing damage. So this chart here shows you the tests that can be performed to diagnose diabetes along with the results that would make the patient diabetic. So if the patient has an A1C of 6.5 or greater, they would be diagnosed with diabetes. A fasting plasma glucose of 126 or higher, and for the oral glucose tolerance test and the random plasma glucose test, if their result is 200 or above, then they would also be diagnosed as a diabetic. To treat diabetes, oral medication or injectable insulin may be prescribed. The most common oral agents are listed below. Metformin is a first-line agent. It's low in cost and has low risk for hypoglycemia, although it is contraindicated in patients with renal impairment. Sulfonylureas can cause hypotension and are contraindicated in older patients due to age-related changes in drug metabolism that can result in a longer half-life of the medication. Melatonidides have a more rapid onset and a shorter duration of action than sulfonylureas, and they should be taken prior to meals. Thiazolidines have a lower risk of hypoglycemia and are associated with fluid retention, weight gain, and risk of worsening heart failure and increased risk for bladder cancer. And dipeptidyl peptidase 4 inhibitors are effective and have a low risk of hypoglycemia. However, they are expensive and their dose must be adjusted for patients with renal disease. Insulin is the oldest and most effective anti-diabetic agent. There are several types of insulins and they all have different onsets, peaks, and durations. Humalog, Novolog, and Apidra are all rapid insulins that start working 15 minutes after injection. They peak at 1 hour and will last for 2 to 4 hours. Humulin R, also known as regular insulin, is a short-acting insulin that is commonly taken with meals. The onset is 30 minutes. It peaks at 2 to 3 hours and will last for 3 to 6 hours. Novolin N and Humulin N are intermediate-acting insulins that have an onset of 2 to 4 hours, peak at 4 to 12 hours, and last for 12 to 18 hours. The long-acting insulins, known as Lantus or Levemir, have an onset of several hours, no peak, and will last for 24 hours or longer. It is important for diabetic patients to take care of themselves and control their diabetes with oral medication or insulins in order to prevent complications. Following a diabetic diet is important to maintain proper weight and also control blood glucose levels. Diabetics should stay away from fried foods or foods high in saturated fat and trans fat. They should also avoid foods high in sodium. Sugary treats such as baked goods, candy, and ice cream should also be avoided. Beverages with added sugars such as juice, regular soda, and regular sports or energy drinks should not be consumed. Carbohydrate counting is another important educational tool for a diabetic to know if they take insulin, so they can determine how much insulin they need based on what they plan on eating. Carbohydrates turn into glucose in your body, so they affect blood sugar level more than other foods do. Exercise is important to diabetics because exercise can lower your blood glucose level. In addition, exercise can lower blood pressure, improve blood flow, burn calories, which will help with weight loss, improve mood, and may give you more energy. Since exercise can cause hypoglycemia, it is important for the patient to monitor his blood sugar before, during, and after exercise. People with diabetes may have problems with their feet because of poor blood flow and nerve damage, so daily foot exams are important. A crucial part of diabetes management is to monitor blood glucose levels with a glucometer. The diabetic patient needs to be educated on how to prick their fingertip with a lancet, then put blood on a test strip, and look at the meter for the current blood glucose level. The diabetic patient must know what is low, normal, and high. Prior to a meal, the blood glucose should be between 80 to 130 milligrams per deciliter. 2 hours after a meal, the goal for the blood glucose level should be less than 180 milligrams per deciliter. The diabetic patient who may be prescribed insulin will need to be taught about the different types of insulins and how to administer them. For type 2 diabetic patients, insulin will be the most likely prescribed either in a vial or in an insulin pen. So the patient may need to be educated on how to draw up the insulin from the vial and administer it to themselves, or to learn how to turn the dial to the correct dose on the pen and then administer it through the pen and dispose of the needle tip. Since foot care is an important part of educating the diabetic patient, here is a chart of the do's and don'ts of foot care. Foot care should be performed daily, including the area between the toes. Proper footwear should be chosen. This entails comfortable, well-fitting, non-compressing shoes. Shoes with a wide toe box will allow for movement of the toes. It is important that the diabetic patient always buy shoes in the afternoon, since feet tend to swell throughout the day. Shoes should be broken in slowly. Start with 30 minutes each day. Toenails should always be trimmed straight across and use a nail file for the edges. Feet should be kept clean and dry of moisture. Lotion should be applied to prevent dry skin from cracking. The diabetic patient should report any complications to their podiatrist immediately. The diabetic should not use sharp objects for calluses, and they should avoid soaking their feet in irritating or burning products. They also should not walk barefoot and should avoid tight socks that may restrict circulation. I know earlier in the presentation you already saw a list of the symptoms associated with a high blood sugar or a low blood sugar, but I just wanted to put it in this section as well because it's very important for the patient to know when their sugar could be too high or too low. Here are some community resources and referrals that might be important to the diabetic patient. An endocrinologist, of course, to manage their diabetes, ophthalmologist for visual problems, cardiologist for their heart, a diabetes educator would be important to teach them, the signs and symptoms of high and low blood sugar, help them with using their glucometer, things like that. Counselor and mental health professional, they are dealing with a chronic disease that can interfere with their life, so it might be helpful for them to speak to someone about how they're feeling. The dietitian can help with food choices to help control their sugar better. Pharmacist can teach them more about the insulin and their medications, side effects. Dentists, they should always get their teeth checked, and a social worker might be helpful with community resources. The CDC and the American Diabetes Association are good websites that the diabetic patient may want to look into. So here are our references. I will give you a minute to look over them. And some more references. We hope that you enjoyed our presentation today. If you have any questions, please feel free to reach out to us. Thank you.